Psoriasis is a chronic skin disease which results in the person developing red, scaly patches all over their body. Some of the common areas of the body most affected are the scalp, the knees, and the elbows. It's non-contagious and has become fairly common among people of all ages. It's triggered by inflammatory chemicals produced by white blood cells called lymphocytes. Many people who are predisposed to psoriasis may be free of symptoms for years until the disease is triggered by some environmental factor. Some common triggers are an infection, the weather, injury to the skin, a bug bite, sunburn, stress, smoking or exposure to secondhand smoke, heavy alcohol consumption, certain medications like lithium and high blood pressure medication, or rapid withdrawal from oral or systemic corticosteroids. People who have psoriasis are at a greater risk of developing many other health conditions, including arthritis, which can cause pain, stiffness, and swelling in and around the joints, eye conditions like conjunctivitis, obesity, type 2 diabetes, high blood pressure, cardiovascular disease, other autoimmune diseases like celiac disease and inflammatory bowel disease like Crohn's disease, and mental health conditions such as low self-esteem and depression. This is where holistic medicine can come into play. By working on optimizing all areas of your physical and mental health, you may be able to reduce the cascade of negative health conditions from occurring by taking the necessary steps to change your diet and your lifestyle, and treat the numerous areas rather than masking the symptoms with a prescription drug such as a steroid cream. The broadleaf plantain, or Plantago major. It's an important medical herb with different pharmacological properties, including anti-inflammatory, analgesic, wound healing, antipyretic, antitussive, anti-infective, anti-hemorrhagic, laxative, astringent, and diuretic. A lotion with plantain, calendula, and coconut oil is extremely helpful for any skin irritation, including mosquito bites, eczema, psoriasis, chickenpox rash, and sores. A tincture of the broadleaf plantain can be taken internally at the rate of 5 ml 3 times per day for a 1 in 6 dilution tincture. This would be equal to half a teaspoon of pure plantain juice. However, it can be very difficult to juice plantain as it's such a fibrous plant. Borage seed oil is a nutritional supplement which is rich in essential fatty acids that can regulate the body's immune system and fight joint inflammation. A review of studies using borage oil topically and other GLA-containing plant oils found that borage oil has both antioxidant and anti-inflammatory effects that can be beneficial for people with atopic dermatitis. Borage seed oil also treats all kinds of skin inflammation, including eczema, psoriasis, and rosacea. A typical dose is 1,000 milligrams 3 times per day. Evening primrose oil contains the same beneficial ingredient, GLA, gamma-linoleic acid. However, borage oil is much better value for money and only half the dose is needed. Iodine can be applied to the skin for skin inflammation like dermatitis and other skin disorders such as eczema and psoriasis, and to kill germs and to heal wounds. Nascent iodine is the safest and best form of iodine to use. Turmeric has been used as a healing spice for centuries. It's popular in both Chinese and Ayurvedic medicine. Turmeric is thought to have powerful anti-inflammatory abilities that may help relieve psoriasis symptoms. Curcumin is the active ingredient in turmeric, and it's thought to be responsible for much of turmeric's healing capabilities. Doses of up to 5 grams per day of curcumin have been consumed, with its absorption enhanced with either using biopterin, which is a black pepper extract, or by frying it in ghee, butter, or coconut oil. Allergic conditions such as hives and virtually all autoimmune diseases like asthma, diabetes, psoriasis, and other skin disorders, and irritable bowel, all involve inflammation. Doctors in Europe and Asia have been prescribing enzymes in ever-increasing frequency for about every form of inflammation known for the last 30 years. The enzyme serrapeptase is a proteolytic enzyme, which in other words means it breaks up and digests protein. The usual dose of serrapeptase is 10 milligrams 3 times per day, up to a maximum of 20 milligrams 3 times per day. Increased occurrences of vitamin C in the body have been found to help control oxidation in the body. A case study of one participant with severe psoriasis found that increased vitamin C eradicated the person's psoriasis within 6 months. Liposomal or intravenous vitamin C are the strongest forms available. The next best forms are the non-acidic forms of vitamin C, with the least effective being ascorbic acid, as it's too harsh on the stomach. The effect of vitamin C is enhanced when taken with bioflavonoids. Doses of vitamin C can vary greatly depending on the type of vitamin C and the intended treatment required. A comprehensive review of scientific studies published in the Journal of the American Academy of Dermatology shows that omega-3 improved people's psoriasis symptoms in 12 out of 15 trials. The benefits included improvement in skin reddening, itching, scaling, and inflammation. Doses range from 3 to 9 grams per day of an EPA-DHA omega-3 fish oil blend. Molecularly distilled oil, which is guaranteed to be free of heavy metals and other contaminants, is recommended. Garlic has strong anti-inflammatory properties and antioxidants that improve skin conditions while preventing skin infections. It also appears to reduce scalp psoriasis. One protocol for allicin garlic extract for psoriasis states take around 1,500 milligrams of allicin powder a day for 2 weeks, then reduce to 500 milligrams for a further 2 weeks. As a maintenance dose, take one 250 milligram capsule thereafter to help prevent further attacks, and cover all psoriasis with allicin cream twice a day also. Vitamin E helps to support the immune system, cellular function, and skin health. It's an antioxidant, making it effective at combating the effects of free radicals produced by the metabolism of food and toxins in the environment. Vitamin E may be beneficial at reducing UV damage to the skin. There's many different forms of vitamin E. For psoriasis, studies show the combination of alpha and gamma tocopherol supplements appear to be superior to supplementing with either form alone for inhibiting oxidative stress and inflammatory factors. People with psoriasis often have low serum levels of selenium, which is a potent antioxidant. In one study, vitamin supplements help to improve selenium concentration in people with psoriasis. 3 Brazil nuts per day help you to reach your daily requirements of selenium. Vitamin D treatment is effective when applied topically to the skin for plaque-type psoriasis. Oral vitamin D supplementation might also be effective as an adjuvant treatment option for psoriasis. The best option is to get a 25-hydroxy vitamin D blood test to determine your levels and then treat any deficiency accordingly. Oral zinc gluconate at 90 milligrams a day showed a significant clinical improvement in psoriasis, and a topical 0.25% zinc pyrithione applied twice daily was also found useful in plaque psoriasis. Recent studies have demonstrated that patients with psoriasis have a significantly higher serum homocysteine level and a higher prevalence of hyperhomocystinemia. We know that folic acid, vitamin B6, and vitamin B12 are all involved in the breakdown of homocysteine in the blood. Therefore, increasing your intake of folic acid and B vitamins may lower your homocysteine level. A good source of folate can be found in fruit and vegetables, especially green leafy vegetables. Systemic folinate calcium, a folic acid derivative, and a topical vitamin B12 have also been found to be effective treatments when treating psoriasis. Glutathione is known as the master antioxidant in the body, and it supports and helps regulate many of the body's processes, including tissue creation and repair, but especially the immune system. In particular, it's been found to have benefits for the treatment of psoriasis. Glutathione can be increased by taking reduced glutathione at up to 1,000 milligrams per day, or N-acetylcysteine at 500 milligrams 3 times per day. The herb milk thistle, and ensuring that you meet your requirements of selenium, as this is needed for glutathione synthesis. You can take a nettle tea and a liver support supplement like milk thistle and dandelion, and that's also good in supporting the organs of elimination and your glutathione. Collagen is one of the most plentiful proteins in animals. It's responsible for several biological functions, one of which is to provide structural support in connective tissue, muscle, and skin. Collagen is the protein responsible for skin elasticity. It also plays a role in joint and bone health. While collagen supplements may not be able to cure psoriasis completely, they can help with the symptoms in conjunction with vitamin C and a healthy diet consisting of whole foods. By decreasing inflammation in your body, this can prompt your skin to heal and for healthy skin to regenerate. Studies investigating the benefits of collagen supplements have evaluated doses ranging from 2.5 to 10 grams per day. However, some supplement manufacturers and other proponents of collagen products recommend up to 30 grams per day. Vitamin K is well documented as a vitamin with anti-inflammatory potential. Although specific studies on the effects of vitamin K in psoriasis do not exist, the probable positive effect of its supplementation in psoriasis is supported by the documented decrease in TLR expression with oral vitamin K supplementation. The optimum dose of vitamin K2 per day is 300 micrograms. After this, your body will not absorb a higher dose, so it's a waste of money to take any more. One should also look at the work of Dr. Weston Price and his study of dietary consumption of vitamin K2, which he even labelled Activator X, and its role in reducing all sorts of diseases and extending lifespan. According to some research, aloe vera has been shown to help reduce redness and scaling associated with psoriasis. The aloe plant gel can be applied to the skin up to 3 times per day. Aloe vera juice, which has been skinned, can also be purchased as a drink, and this may be beneficial to the immune system and the skin and also help. There's some foods that help fight inflammation that can help with psoriasis, such as eating fruits and vegetables, especially berries, cherries, and leafy greens. Eating salmon, sardines, and other food rich in omega-3. Antioxidant-rich herbs like thyme, sage, cumin, and ginger. And heart-healthy fat like olive oil, seeds, and nuts. There's many foods that should also be avoided if you have psoriasis, such as gluten, dairy, processed foods, alcohol, caffeine, and all the nightshades. Red meat, also containing the polyunsaturated fat called arachidonic acid, is an inflammatory substance which will make psoriasis worse. Processed pork may be one of the worst foods, so sausages, bacon and other processed meats with added nitrates should be avoided also. As psoriasis is associated with other serious health conditions such as diabetes, heart disease and depression, be sure to check out my other videos on blood sugar, blood pressure and cholesterol, as well as my video on sleep and other ways to improve your mood, such as my video on lavender and my video on CBD.